Hi, my name's Emerson and I'm doing my video presentation over tuberculosis. TB is an infectious disease caused by bacteria that most often affects the lungs but can also affect other parts of the body. Based on this diagram, these are the lungs of the body, and basically a germ called Microbacterium tuberculosis enters the lungs, which spreads to the bronchioles, which are shown here in the diagram, and then basically you have veins and arteries also in your lungs, and that's how your air kind of filters and stuff, which goes to the alveoli, and then these kind of look like grapes. That's the best way to describe it. And then if you zoom in closer, they have these macrophages on them, and this is where the disease will multiply. And yeah, so there can also be inactive TB, which won't spread to other people, but if the immune system can't stop them from multiplying, it will grow in the body and eventually become active TB. Transmissions of TB is an airborne illness. So what this means is that it spreads through air. TB germs can get into the air when someone with active TB coughs, speaks, sneezes, and even sings. People with inactive TB, also called latent TB infection, cannot spread germs to others, according to the CDC. Germs, however, are not spread through sharing drinks, food, kissing, or touching hands because it's not actively going into the lungs. Symptoms of TB, according to the World Health Organization, are prolonged cough, chest pain, weakness, weight loss, and fever. Symptoms may be mild for months, so it's easy to spread TB to others without even knowing it. Some prevention for TB, according to the World Health Organization, is to seek medical attention if you have symptoms, as early treatments for TB can be very helpful and improve chances for recovery. So treatment methods of TB include antibiotics. These are taken daily for 4 to 6 months, but since they are antibiotics, if you do stop taking them early or miss a day, it can cause the TB to become drug resistant, which requires different medications after. This kind of TB will occur when TB medications are taken inappropriately. So let this be your sign to go get tested. Tests include skin tests, they include blood tests. So basically the skin test will just kind of go through the arm, and you'll go back after 7 days for a second one. Or you can do a one-time blood test. And I would recommend doing this before you go around younger children, elderly, or people who are in high regions with TB prevalence. Thank you.